am Dr. Nurhüda Karaca Cengiz, working in the Eskişehir City Hospital, and I'm the child psychiatrist, and I will be talking about what the mind says in social media. And so, as the presentation plan, first of all, I will be uh, talking about definition, prevalence, and etiology of the social anxiety disorder, and then I will be talking about the role of the cognition in the social uh, in social anxiety disorder, and then executive functions, theory of mind, and the metacognitions, and then I will be finally talking about research that we have concluded in 2022. And so actually it was first identified in 1903, and which were associated with the anxiety felt where they were playing the piano. And so it says the phobia, anxiety disorder, characterized worried about doing something and activities, and the various social interactions may have an experience of for the, and it can be in front while talking in front of a large group, or while simply walking or being scrutinized by people. And you see the prevalence is 12% around the population, and it starts generally during the childhood period, and early onset or untreated in childhood and adolescence may constitute a risk for persistence in adulthood period, and therefore it can be devastating for all areas of life, and especially in academic performance, relationship, and also in romance and all other work productivity as well. So I would like to talk about, and so the Spence and Rape has a study that tells about etiology of this disorder, and like in other anxiety disorders, there can be the similar, like the genes and temperament, and also proximal factors, behavioral and cognitive processes, and also external factors, the peripheral factors, parent influences like the peer influences, and also adverse social outcomes, negative life events or culture, and these can lead to emergence of the social anxiety on some particular level, and then it may lead to other contributions. And of course, cognition may also has a central role in the SAD, influencing how individuals perceive, interpret, and respond to social situations. And also, we see that they have dysfunctional assumptions, like the expectation of a social situation. And for example, they may say, I should always speak fluently, or they may have a negative social cognition about oneself. I will be flushing or sweating, or they may be having some anxieties about other people's reactions, like for example, the people will be thinking that I am odd, or another examples can be given. So I would like to talk about a cycle, and for example, when I talk in front of the others, they will be laughing at me, and we are calling this process as the pre-event processing, and then it will be leading to a dysfunctional conclusion, and it which says if I have to talk in front of others, I should be so fluently, they say, then this may they may lead to emerging of the psychological symptoms like the trembling of voice and increased perception of the body reactions, like the self-focused attention, and then the person, the individual ruminates about these past social situations, and which means that post-event processing occurs, and the negative expectations regarding the similar situation, and then it may lead to negative expectations for the similar situations, and consequently social situations are to be avoided by the person in the late future period. And the social anxiety disorder is being considered, and the conditional and conditional beliefs are defined to be as self-efficacy beliefs, which is ego-systonic and ego-dystonic situation, marijuana. And and it can be leading to social events or often associated with the fear of specific social conditions. And Fenningston and colleagues in 1975 stated that it's individuals generally focus on different points in terms of attention, while some of them interested in the inner feelings and thoughts, while the others may be focusing on the external environment and the others. And also self-consciousness is directed to inwards, intention inwards. It can be private and the public attention. And for the private self-consciousness can be referred as an awareness of one's inner thoughts and the feelings. And so I will be talking about the general self-perception, self-consciousness, which refers to awareness of the self as a social object. And especially it may give a peak, especially during the adolescence period, and it may be effective in the development of the social anxiety, especially for the adolescents, especially. And so in daily life, it may be related in both adolescents and adults with the daily behaviors. And of course, for the medication, this may be effective in the short term, and however, for the severe cases or treatment resistant cases, combined treatment can be recommended for the long-term effect. And however, as you know that, and on the and for the CBT and proven efficacy of the CBT, the treatment of the anxiety disorders have 30% efficiency as reported. And however, for the young people, yes, it may be lessen the visible diagnosis, and however it showed that the recurrence rate may be higher, and because it shows that especially only self-cognitive abilities and may not be enough, and especially this very high level cognitive abilities like executive functions, theory of mind, and the metacognition contribute to development of the other parts. First of all, I would like to talk about the executive function, and which means that especially this is it starts with as a unitary factor, and it is completed as a three-factor model in adolescence and adulthood. And this three-factor model may encompass inhibitor control, and it helps individuals to control behaviors that are not appropriate for their circumstances. And cognitive flexibility, on the other hand, it's a high-level executive function defined as the individual's ability to switch between the tasks or to change the mental organization of the information. And working memory, on the other hand, and ensures that the information is processed and executed. And the executive function, together with the EFs, help to reach goal-directed behaviors, and therefore essential for the success in school and the working environment. And there are, for example, Stroop is used better as it is the more compise and shorter and more brief, and therefore there are CANTAP and the CNSVC. They are used for the pre and the post treatment processes. And in order to for the need of attention and inhibition control for the child in the social contexts, and for to practice the social skills, and so cognitive flexibility, and has provides the ability to cope with the complex emotional scenarios, and it has shown that it has positive consistent correlation with the emotion recognition in various populations, and working memory may also play a role in the recognition of the other's emotions due to the need to process the emotional cue while temporarily holding in it. So, due to all the reasons that I have mentioned before, and the importance of the importance of examining all this mental process in social anxiety disorder can be better understood, and so especially then it is seen that these individuals have been reported to perform worse on self-reports scales assessing, especially for the brief scales, and for the individuals with the SAD, and so or they may be also, and in the executive functions, attention-oriented tests, and also sustained attention tests were also less performed by these people. And also working memory was observed in adults with SAD compared with the control groups, and associated with the severity of the social anxiety, and because it is an evidence that working memory interventions and are effective in the effective treatment of the generalized social anxiety disorders. And so I would like to talk about the theory of mind. And this theory is defined as the ability of the individuals to understand the mental state of themselves or the others, and also to predict their behavior, which was firstly put on the table by the Premack and the Woodruff in 1978. And well, they were asked to monkeys to show some videos, and they were given some and they provided some cards, and actually to match them, and to try to measure whether they can also link them together. And the Baranquan actually started to evaluate these issues in starting from the 1990s, and they continue while assessing to all of them. There are some tests that they are using, and this is the Salian test, and for the first level, and also and another is and you see that in the scene one, they puts something in the cupboard, and so and when the and then somebody else moves it to somewhere else, and the people, and actually in the first place it can be really so limited, and as the age develops and the cognition develops, it also develops. And also here is the ice cream truck, and it's a bit complicated. However, the same with the previous one, and actually, and they are asking, so he can, and he can, she, and she's asking, she can hear from the school garden that the ice cream seller is coming, but the boy cannot hear, and he is asking to his mother. And there are two aspects, like the social emotional aspect and also social cognitive aspect. And for the social emotional aspect, so we are using the eye visuals and also face expressions, and it is called the social emotional uh, concept. And so social cognitive means is considered as the observing the other acts and try to estimate the next actions of the people using this. And in our country, this is also valid for our country, and so I think it was 32 for the adolescents and 28 for the adolescents, and so and and actually they are asked which one applies for the person, and this one also this one is the same for the emotional, for the remet, and so it's here for assessing the skills, and they are questioning why he has said this and whether it was relevant and what the person may have felt while talking about it. And however, here there is no image, and so there is only social cognitive. Here there isn't, because there is no illustration in the second one. And especially considering that socially anxious individuals have more negative thoughts about the thoughts of the other person with whom the dialogue is established, it can be considered that mind reading is important. And so therefore, in various studies conducted in adolescents and adult samples diagnosed with the SAD, it has been shown that especially the total scores of the ICE test were lower compared to the control groups, and for the movie-assisted test, the success rates were also lower on the SAD suffering patients. And also metacognition is referred as a system that enables the individual to be aware of the events and processes in his mind and to manage them appropriately. And especially for MCT has been reported to be effective for some various psychiatric diagnoses, with the strong evidence available for the anxiety and depression. And although the results suggest that MCD may be much more effective. And there was a 9 years of follow-up study, and it has been seen that metacognitive therapy, the recovery rate is around 57%, while for the CBT is around 38%. And so and for the in the it was showed that the diagnostic recurrence rate was around the 9.5% on the MCT group, and the same rate were around 21.3. And however, they say that the metacognitive group is much more higher efficiency they have according to these results. And actually, for the last 6 and 7 years, and in a systemic review, and they have checked the positive and negative metacognitive beliefs, and also that needs to be controlled thoughts, were shown to have a positive and significant relationship. And it was also shown that there is a direct or indirect relationship with the MCT as well. And therefore, as the clinicians, we need to evaluate whether the use of awareness techniques related to the metacognitive processes may be useful for the treatment or not, or also we may also need to check whether this social interaction anxiety and the social self beliefs and metacognitive beliefs should be central target in the treatment of the SAD. And it's a study result that was conducted in 2023. And so I would like to talk about our own research, and we completed our research in 2022, and so we have identified and we have created 40 SAD members with the control group as well. We have included with the score of 84 or higher, and then while grouping them, so we have checked the relationships in the FPR and cognitive flexibility, and so we have performed GNS and the F4 test as well, and we performed also self notification protocol as well, and we have seen that This especially, and we have seen that FPR and MET positive, and also EEF also has been reduced, and we have seen that also metacognitive skills are different between the two groups, and however, on the other hand, and there is no relationship was established between the metacognitive skills and the TOM, and it also derives a conclusion that we should not limit ourselves with one social aspect only, and it also shows that we should be also talking about and concentrating on the cognitive part as well. And thank you very much.